Hey, it's Tim Reha with Digital Health Live at CES 2014, sponsored by Idea Life. Really cool panel of how digital health saved my life. So we have Dr. Saroj Misra.
Yep, Dr. Saroj Misra. Thanks very much.
So I got that with the coolest tie in town here. What is that? You got to tell
everybody. You know, what this is an Eldridge knot. It's a special kind of knot. Not a lot of people know how to tie it, but I love tying unusual knots. It's often a great conversation starter, and I like to think that I think a little bit differently. This is one way I show that.
Yeah, touch a class.
Yeah, I tried.
So tell us about your background and where you're working now.
Absolutely. Well, I'm a family physician in Southeast Michigan, and what I've been doing is working as a program director for family medicine residency. Recently, I've become the director of clinical clerkships for third and fourth year students at Michigan State University's medical school. So that's kind of what I'm doing now, Tim.
What was happening inside? I mean, this is a big impact topic that's about life and death.
Absolutely. What we were talking about today was about how medical technology and digital health technology saves lives. And where I was talking about it on a personal level, in the trenches. I've had a lot of patients where I've been able to use new products that have come to market to access information much quicker than I've been able to in the past. Being able to make sure that my patients are safe, especially when it comes to new medications, interactions that can occur, adverse reactions that can occur. I talked a little bit about how technology also saved my daughter's life. She had a severe life-threatening allergy at birth, and we didn't know about that. But using the technology that was available and being able to look up things that I wouldn't have been able to find 10 years ago without going to a subspecialist, I was able to identify what was going on and make sure she's safe today.
What else was really hot in terms of topics today?
You know, we've seen a lot of really interesting topics today in that forum. We've seen the ability to help in disaster relief, what happened in Japan. We saw how groups are working to ensure that patients who have hypertension immediately after disasters are able to be cared for by rapid action teams. We saw another group that was talking about exoskeletons, bionic skeletons that can help people who've never been able to walk again. And these are all examples, very dramatic examples of how digital technology can save lives. My area, digital technology is working to save lives every day. It may not be quite as dramatic, but it is those simple things that we do on a day-to-day basis that are really critical.
Well, I'm excited for you and what you're doing now. How do people get a hold of you?
Well, you know, I've been fortunate enough to work with a lot of thought leaders in digital technology. One of the groups that's been very instrumental in helping me to kind of get interested in this was Hippocrates and Athena Health. And Hippocrates has been great sponsoring me coming out here today to kind of share my stories. I found their products to be very useful, and I've been using them for about a decade, and they definitely are products that have started to change the way doctors access information in a rapid, quick time format to make sure that the patients are getting what they need right at the time they're seen.
It's good to see real-time data permeating the health.
Absolutely. These are the kind of things I think that are going to really shape how we do things in the future, ensuring that our patients don't have to go see multiple doctors over months and months and months to make sure that we're able to give them what they need right when they see us and maybe save them money, time, and effort in taking care of themselves.
Okay. Do you have a Twitter account, a personal Twitter account, or a website?
I do have a Twitter account. You can reach me at SarojM, S-A-R-O-J-M, and I'm also on Facebook as Dr. Saroj Misra. You're welcome to find me there, or you're welcome to go to our website for our healthcare system, St. John Providence Health, where I practice, or to Michigan State University's website. You'll find me there as well.
So if you want to learn how to do the tie too, you can hashtag Saroj's tie, and we'll like that one. So thanks so much for being on the show.
Thank you, Tim. You have a great day.
Cheers.
Thanks.